All right, so you can hear me, and I hope you can see the screen as well. Let me know if you can, and then just jump in and say hi. Tell me where you're coming from. Oh my gosh, we have people from all over the world here. We have quite a number of people on this webinar. Hi, Renee. Hello, Kristen from Minnesota. Hello, George. Oh my gosh, from the UK. Good. Let's see. It's not too late there yet. Good. All right, so let's get started. Hi, Brittany. Oh, from Texas. Yep, I lived in Texas for quite some time. All right. Oh, and another Texan, Sarah from Austin. Good to see you. Hello. So let's jump right into our topic today because I know all of you have busy lives and being here from all over the world. Some are on your lunch break, just fitting this in between your patients and clients, and some of you are finishing your day. So I want to get focused on the topic at hand that really there's this challenge in the world of health coaching, in the world of nutrition. Where is the distinction between these two skill sets? And depending on your professional goals, is the skill set that you need? Where do you need to focus your attention on developing your skills, on practicing your skills, on working with clients using these skills? And, in some cases, it really just depends on your particular professional goals. So let's jump in and first define what the difference is between nutrition and health coaching. And if you have questions along the way, feel free to pop them in the chat box. If and we'll get to them at the end. We have lots of time for questions at the end. So our objectives for today are to understand the distinct definitions between health coaching and being a nutritionist. So being a health coach versus being a nutritionist, and how those definitions are evolving. We'll be talking about some case studies about when we use each skill set, how to use each skill set. We'll be also determining where to continue your education to strengthen your skills in either nutrition, in health coaching, or in both. Because again, it depends on your professional goals, it depends on your practice setting, it depends on what other clinical licenses you have, where you're going to focus your continuing education. Every single healthcare professional, whether you're a world-renowned surgeon, 1 year, your first year out of occupational therapy school, or your first year as a nurse, or you've been practicing for 10 years as a physical therapist, no matter where you are in your practice as a nutritionist, as a health coach, as another health professional, you always need to be developing your education, your skill set. The research evolves, practice patterns evolve. Really in the United States here, we're in the midst of an entire revolution of our healthcare system. So as professionals individually, we want to, stay on top of that in ways that are relevant to our practice. And if you don't know me, I just want to introduce myself for a moment. My name is Jessica Drummond. I'm the founder and the CEO of the Integrative Women's Health Institute, where we train professionals from all over the world. We have students now in about 30 countries in skills of both health coaching and functional nutrition, but from a functional medicine perspective, so otherwise known as functional nutrition. And we have colleagues and faculty members that come from a variety of disciplines, from physical therapy, acupuncture, nutrition, coaching. So we take a wide lens and an integrative perspective when training the professionals in our programs. So let's define these terms. What is a health coach? So in about 2007, the International Coach Federation, which is an organization that supports coaches of all different kinds. It actually began with business coaches. So it came from the world of business, not from the world of healthcare. And the International Coach Federation in 2007 discussed what a coach is, kind of updated their definition, and defined it as a professional coach. So professional coaches provide an ongoing partnership. That's important. The relationship between the coach and the clients is part of the healing modality. And that is true whether you're working one-on-one with clients or one to a group. The relationship between you and your clients, and even between your clients if you're in a group coaching session, is a part of the healing modality. So you have to be really monitoring it and making sure that it's productive and positive, and the relationship is ethical and has certain boundaries. Because it's not just a friendship, it's a healing relationship, and in a similar way, but distinct from how the relationship between a psychotherapist and her client is a healing modality. The relationship between the physician and her patient is part of the healing modality. So that relationship is important. That ongoing partnership is designed to help clients produce fulfilling results in their personal and professional lives. So that's the goal of health coaching. So improvements, happy results, fulfilling results in personal and professional lives of our clients. Coaches help people improve their performances and enhance the quality of their lives. Coaches are trained to listen, observe, and customize their approach to individual client needs. So it's not exactly a coaching relationship if you are just teaching information and you're not getting any feedback from your clients. That's an education relationship. Now, you don't have to physically be in the room with them. You can be doing it via webinar. You can be doing it via like a live call or a video conference. But we have to be listening to and observing our clients for us to be establishing a coaching relationship, not just giving them information. The clients seek to elicit, the coaches seek to elicit solutions and strategies from the client. Again, this is very distinct from education. We're not saying, I recommend that all people to be healthy should sleep 8 hours a night. What we're doing is gaining a lot of information from the client and customizing it to what they need. We'll ask questions like, after how many hours of sleep do you feel the most rested? What is the best time for you to fall asleep and wake up for you to feel the most rested, the most energized the next day? It's not a prescriptive, 95% of people in XYZ study felt better when they slept 8 hours. So my recommendation to you is you sleep for 8 hours, going to bed at this time, because that's what the study population found to be most effective. Now, that may be useful information, but that's not coaching. Coaching is eliciting the solutions, at least initially, from the wisdom that the client already has. And if they don't have the answer to that question, then it's an exploration that you take on together, which may include gathering research data. All right, so we elicit solutions and strategies from our clients. We believe that the client is naturally creative and resourceful, and that our job as coaches is to provide support to enhance the skills, the resources, and the creativity that the client already has. So what is a health coach? So that definition from the ICF is essentially the definition of any kind of coach. You can be a relationship coach, a business coach, a tennis coach, whatever. Then health coaching grew out of actually sports coaching. The sort of original health coach was Tim Gallwey, who wrote The Inner Game of Tennis. And he was a traditional sports coach who was really educating more than coaching at first in the beginning of his career. And by the time he wrote this book, The Inner Game of Tennis, he realized that there was a lot of value in getting out of the client the wisdom, the skills, the potential that they already had, rather than trying to fit them into a box of a certain technique or practicing in a certain way. It was about using the client's own resources to maximize their potential as a tennis player. So his definition of coaching is unlocking a person's potential to maximize their own performance. It's helping them to learn rather than teaching it. So you trust the client. I was just today working with one of our students, and especially when we come to coaching from either an education background or a clinical background, there is an unlearning that has to occur where we have to trust that there is a lot of innate wisdom or experience gained wisdom within each client, that they've already got most of the answers. And that's a hard shift to make, but that's one of the big keys to coaching, which is distinct from making clinical recommendations or providing education. So Duke Integrative Medicine was one of the earliest health coaching programs with a pure kind of, pure coaching focus. And they defined health coaching as integrative health coaching creates dynamic partnerships. So that's very similar to ICF, that moves clients towards satisfying and healthy lifestyles. So not just a life, but a lifestyle, behavior changes that are healthy in terms of optimizing physical and emotional and spiritual health. Integrative health coaches use both innovative and practical strategies to help clients clarify an optimal vision of health. So the client themselves is defining what that means to have, what is their optimal vision of health. Might be completely different from your next client, might be completely different from your vision of health. Explore options and steps for realizing that vision, enhance personal accountability. So most of the work is on the client, not on the coach. And take action. So the client needs to be taking action to achieve and sustain her goals. Coaches facilitate behavior change in a structured, supportive partnership with clients. They invite insights and clarity through inquiry and personal discovery. By focusing on the mind, body, and spirit and the whole community, integrative health coaches help clients make changes that support that client's values and that client's vision of optimal health. So in many ways, health coaches are behavior change specialists who support clients who are living in such a way that their behaviors, their eating behaviors, sleeping behaviors, moving behaviors, thinking behaviors, all these different lifestyle behaviors are contributing to poor health and shifting that. So they start contributing to improved, idealized, optimal health in whatever the definition is that is defined by that client. Because really, it's a continuum. You can always get healthier, right? You can always get sicker. So it's just moving along that continuum. So we now have, as health coaches, an official board, consortium of, I think it's about 70 stakeholders in the world of healthcare, including a number of health coach education organizations, education facilities, a number of teaching hospitals, insurance companies. So lots of people who have, I guess a stake in the game about what the definition of health coaching should be. So these 70 organizations came together and formed the National Consortium for Credentialing Health and Wellness Coaches. And this is an organization in the United States which is aiming to standardize the training of health coaching so that it meets certain standards and creates, a specifics regarding what health coaches should do. And we'll talk more about this in our webinar in a couple weeks, specifically about the NCC HWC. But I think it's a step in the right direction. The goal, like in every health profession, so I originally trained as a physical therapist, and now physical therapists are licensed to practice in every state in the United States. Many health professions are on that continuum. So nutrition professionals, naturopaths are not licensed in every state. They're licensed in some states, and the requirements do vary from state to state. So for health coaches, and massage therapists is really the same thing. For health coaches, the goal is to have licensure. But, first we have to get through the hurdle of defining the job. What actually is health coaching? What are the job tasks? And then making sure everyone has similar training and then can pass a national board exam. The first national board exam will be offered in January or slightly after that of 2017. And the programs that are participating in this accreditation are, undergoing that process right now. Our institute is one of the accredited health coaching programs. And so This organization is, actually really a big group of organizations. It's a volunteer, third party, independent organization that is working to define what health coaching is so that health coaches, so that the public can know what health coaches are and what they do. And so can other health professionals on the healing team. So their definition of what is a health coach is that a health coach is a health and wellness, health and wellness coaches partner with clients, so that's a consistent theme, seeking self-directed, lasting changes aligned with their values, which promote health and wellness. So again, it's about the client's vision of health, the client's values around their health, and the relationship is mostly directed by the client. What the client, they take ownership of making changes in their own lives and thereby enhance well-being. In the course of their work, health and wellness coaches display unconditional positive regard for their clients and a belief in their capacity for change. So a little what I was talking about a minute ago, if we come from a clinical background and we become a coach, we've got to really get comfortable with trusting our coaches, our clients, having beliefs that they have capacity to change, and then, helping them to believe that as well. And honoring that each client is an expert on his or her own life, while ensuring that all interactions are respectful and non-judgmental. And then at our institution, we've defined health coaching as coaching is unlocking a woman's potential to live a healthy, vibrant, and purposeful life as a whole feminine human being by her definition. Again, I think it's very important that the relationship is led by the client. Coaching is supporting her to transform with a full suite of resources and skills. Health coaches do need resources and do need skills rather than fixing her. So our job is, it's not like when you show up in the ER after a car accident and someone has to fix your leg, put you back together. That's not the perspective of a health coach. And again, the students that we teach that come from clinical backgrounds, and I did the same thing, really have to make a mindset shift around, we're not there to fix our client. We're there to draw out her potential that's already there. And maybe she just needs some resources and we need to support her with specific skills. So what do health coaches do? Part of what the NCC HWC did was undertake a study and they surveyed quite a number of health coaches. I don't know exactly how many, but quite a number of health coaches all over the United States, and essentially asked them, what is your job? What exactly do you do? And that's known as a job task analysis. That was done in 2015. As far as I'm aware of, there is not an official body for health coaching professionals outside of the US. So no third-party independent group that is doing this in other nations. So my expectation is that many other nations may follow the lead of this group, but that may or may not happen. So there are 4 domains of tasks that health coaches do. And the first domain, basically the tasks that comprise and define this domain, are concerned with the activities that take place in the initial stages of the coaching process. So basically, you and your client are figuring out if this is a good fit, if coaching is the appropriate modality for them, or if they really should be seeing someone who's a psychotherapist, or if you should be collaborating with someone who's a psychotherapist, or if you should be collaborating with a nutritionist, and we'll get into that in a minute, or if you should be collaborating with a physician or a physical therapist or another health professional. So is this an appropriate client? Are they somewhere along the stages of behavior change? They're not in what we would call in behavior change theory, pre-contemplation. They haven't just shown up at your doorstep being like, I don't want to be here. I don't think I really have anything to change. I honestly think I'm just fine right now, and I'm really not interested in doing that. Well, they're in pre-contemplation. They're not ready to be a part of a coaching relationship, and they may not be. Now, you can certainly talk to them. They could be a part of educational programs to maybe move them along the continuum a bit, but they're probably at that moment not ready to be a coaching client. So we're going to be interviewing our clients, seeing if they are appropriate candidates. And we'll also be setting up the relationship such that it's a very professional relationship. We have a coaching agreement. We have fee expectations. We have how many sessions they'll attend, the length of the sessions. Will they be individual or in groups? Will they be by phone or in person? So domain 1 has to do with those kinds of tasks. In domain 2, health coaches do the meat of the coaching. So they sit with their clients and they draw out their vision. What does it mean, to them to be healthy? What does that look like every single day? What does that look like in terms of their work and their relationships and their energy levels and all of that? Past successes and challenges. We look at their history, assess readiness for change. Where are they along that behavior change ladder? Pre-contemplation, contemplation, action, that kind of thing. Do they have limiting beliefs that we have to be mindful of? Working on goals. So not just a grand 5-year, 10-year vision, but what are the small baby steps that these clients can take each week or every 2 weeks? And are those goals measurable, specific, time-based, and so forth? And this relationship is always led by the client. So we want to hold the client accountable to moving forward towards her vision, but in a way that resonates with her. In domain 3, the tasks and knowledge that comprise this domain are concerned with the activities that support progress from where you meet the client to her actually landing in meeting her goals and landing herself in her vision. And, because we can just be a safe space for clients to talk, which is fine. And at times that's very appropriate, but that's not coaching because we don't want to keep our clients stuck in their story. We want to help them make progress. And that progress does not have to be linear. It almost never is, but we want to keep them. If they're going to change course, we want to make sure that they're, deciding, mindfully changing course, making the decision to change course. They're not just, following the flow, right? Because the goal is to actually meet their health goals. And in domain 4, this is important because coaches have to know the limits of their scope of practice. They have to understand the laws around. Now, there's not really laws around health coaching, but if they're doing anything like offering nutrition information or fitness information, they have to understand if that's within their scope of practice or not. And it depends on the licensure laws for nutritionists and for physical therapists and fitness instructors and physicians in their state, so that they are not practicing outside of their scope. And health coaches also certainly need to adhere to a code of ethics. We don't want inappropriate relationships with our clients. Make sure we have healthy boundaries around that relationship and so forth. And health and wellness coaches engage, just like every other health professional, in continuous process of training and education. So if you kind of sign up to have health coaching be your career, expect that, just like if you become an attorney or a physical therapist or a physician, that for the rest of your career, you'll be doing continuing education every single year to be developing your skills. So that's the job of a health coach. Now, the expertise of a health coach is essentially that health coaches are the experts on the healing team in behavior change, health goal setting, and achievement. So this is where to be a health coach is distinct from being a business coach or a tennis coach or a relationship coach. Not only are you an expert in behavior change, but you have some knowledge about evidence-based, so based in the research, healthy lifestyle behaviors. You make, because there are points in time in that coaching relationship where you are exploring recommendations, you're exploring ideas for how to achieve a goal. Let's say your client, one of their goals is to lose 10 pounds in 4 months. Okay, that's realistic. How are they going to go about doing that? By starving themselves and, running themselves into the ground? Well, that's not evidence-based nutrition and fitness information. So as a health coach, we need to understand the research. We need to be reading the literature going to continuing education about lifestyle medicine, about nutrition, about movement, about sleep, about social support, smoking cessation, wearing seatbelts. I mean, all of these basic things that have huge impacts on a person's health outcome. So that's the difference between a health coach and a business coach, is that a health coach has wisdom in knowledge, research-based knowledge in lifestyle medicine, and has a team of clinicians so that when she hits the limits of her knowledge, which will always happen no matter what kind of a clinician you are, when you hit the limits of your professional expertise, then you have colleagues to refer your clients to that have even more expertise in that particular domain of health. So whereas a business coach would have wisdom and knowledge and training and experience about business, marketing, and, sales and financial, keeping financial profit and loss statements. So that's really the difference. Both are coaching the client, pulling ideas and wisdom from the client. But then when that client hits their limit and they need to explore more ideas, the health coach needs to have some training, some knowledge, and some resources to help the client gather those ideas about health. So, basically the goal of the expertise of a health coach is to assess the domains of health for each client. So is this client healthy? If we kind of look at a wide lens of defining health, and how are those domains impacted by behavior change? So in the Integrative Women's Health Institute, we use the Holistic Women's Health Assessment as a tool to look at each domain. And we believe that, an individual woman will be at her healthiest when all of these domains are taken care of, when she has a positive perspective about her ability to take care of her health, when she believes that she's got the capacity to get better, when she has a great connection between herself and her healing team, herself and, she's got support networks and friends and helpful spouses and, all of that. Nourishment, she's nourishing herself with food, with sunlight, with sleep, with art, with beauty. She has strength, she has physical strength, she has resilience, she has emotional strength and resilience. Contribution. She feels like she's doing something important in the world with either her work or her parenting or her relationships, volunteer activities. Attention. So that's everything from literally being able to attend. She doesn't have brain fog and short-term memory deficits, but she also can carry projects through to completion. She can commit to something and complete it, and she may change her mind along the way, but when she makes a decision, she carries it through. And also rest, which is extremely undervalued in our society, as all of you know. So that's everything from sleep to relaxation to just flat out pleasure and fun. So we assess our clients from a wide lens, and thus we have to have some knowledge about health. How do health coaches work? So if you become a health coach, there are lots of different jobs for you. You can start your own private practice and work individually or in groups with clients. This is the most common practice capacity right now because health coaching is quite new and it's not yet in most major hospital systems an established health profession. Not every academic medical center has a health coach on staff. That's changing. There are some health coaches at the Cleveland Clinic, at Duke Integrative Medicine, and I think that will evolve even further as NCCHWC standards become recognized and understood. But for now, most health coaches are in private practice. So individually, we've got to develop networks of colleagues so that we can make sure our clients have great resources for every domain of health, every aspect of health. Other times, there can be multidisciplinary practices that may have a physician, a acupuncturist, a health coach, a physical therapist, a fitness professional, massage therapist, all under one roof. That happens. Health coaches are the expert on the team to support the clients to establish healthy behaviors in the midst of real world challenges. And health coaches often have additional expertise in fitness, nutrition, stress management, mindfulness, or sleep, or they do work in a multidisciplinary capacity, either right in the same building or same practice with these other clinicians who have this expertise, or they build those networks themselves by getting to know other clinicians who have that expertise. Now, a nutritionist is different because we do have legal definitions of nutrition. So if you decide to become a nutritionist, whether or not you can and what standards you have to meet, and if you can call yourself a nutritionist or a certified nutritionist or a licensed nutritionist, all depends on the Legal Practice Act for nutrition. That depends on where you live. So, in Connecticut, you can be licensed as a nutritionist under various paths. You can go to undergraduate school, become a registered dietitian, do an internship, take an exam, pass the boards. You can do a sort of an alternative pathway, get a master's or a doctorate degree in nutrition. You can pass the CNS exam, pass the boards, and become a licensed nutritionist. Now, in many states, including Connecticut, you can be a nutritionist. So you can use that term. You can give people information about nutrition, but you can't tell people that you are licensed or certified as a nutritionist. So in some states, it's about what term you use to call yourself. And it also, these lines are gray, and this is really a question that you need to be sure you're asking your attorney before you go into practice as a nutritionist in any state. But, there are sometimes a certain line of what kind of information you can give. Can you give general information that would basically be useful for anyone? Like, it's generally a good idea, to go to sleep relatively early when you're tired. And it's generally a good idea to eat vegetables more than you eat Oreos. It's generally a good idea to eat lean forms of protein. Like, you can make nutrition recommendations that are generally a good idea and not harmful. And in most states, that's fine. But if you want to get more specific, like you're working with a client who has intestinal permeability issues and they need a certain dosage of zinc, and you have to know how much zinc to give them, and do they need copper to balance out that zinc, so your level of expertise as a nutritionist can also expand as you grow your practice. But to define yourself as a nutritionist, that is entirely dependent on the laws in the place where you live. So in the US, that's going to depend on your state, and it may depend on your country or province in other locations. So, so a place to begin about figuring out what kind of nutrition practice you can have is to look at the nonprofit organization nutritionadvocacy.org and speak to a scope of practice attorney in your area. And in a lot of states, you may not be a nutritionist, but if you're a physician or a physical therapist or an acupuncturist or a chiropractor, you may be able to offer nutrition information under your state practice act because maybe you have a wellness clause or something like that. So it depends on what your other training is as well. So whether or not this is required by your state law, ideally, a nutritionist is skilled in individualized, evidence-based nutrition recommendations. So what I mean by that is, so here's a mini case study, right? So let's say you have a pregnant client who's training for an athletic event. The nutrition recommendations that she is going to be given will be extremely different from the nutrition recommendations that you are going to give to a man who has just undergone heart surgery, right? It's a 50-year-old man, a 27-year-old woman, one's pregnant, one just had a major surgery. You have to know the research to be able to give those two very different cases, appropriate research-based recommendations. And also, really know that client, because one of them may almost exclusively eat at restaurants. The other might be great at cooking. One might be from Asian descent. The other might be from North African descent, and they have very different, cuisines that they grew up on. And that can also affect their genetic variability. So A nutritionist will understand how to make skilled recommendations for each client based on the available research, plus your experience as a nutritionist, the experience of other experts in that nutrition specialization. So maybe you've gone to 10 continuing education courses about how to make nutrition recommendations for pregnant women. Well, that pregnant client might be right in your wheelhouse as a nutritionist. And we'll talk more about specialization in the webinar next week. But maybe that heart surgery patient is just not appropriate for you, even if you are a licensed nutritionist. You haven't done the deep work to give him really good recommendations. And of course, the patient's wisdom and intuition always comes into play. And what is a functional nutritionist? Oh my gosh, there's so many terms, right? Are you getting clearer now? I hope so. Let me just ask. Type in the chat box if you feel like, okay, this is starting to make sense. I'm feeling a little clearer. I'm not confused by all of this alphabet soup and these terms right now. How are you feeling? Type it in the chat box for me. All right, good. No questions. Everyone's okay? All right, great. All right, good. So let's talk about what is a functional nutritionist. A functional nutritionist is a nutrition professional who uses the principles of functional medicine. And functional medicine, so this is a slide from one of our training programs. As you can see, it's a little fancier, but functional medicine is a discipline neutral practice perspective. So you can practice functional medicine if you're a physician, a chiropractor, a naturopath, an acupuncturist, an occupational therapist, a nurse, a massage therapist, whatever. You just have to have this perspective. And the perspective of functional medicine is the belief that most chronic disease is preventable and most is even reversible with an individualized, integrative approach addressing genetics, diet, nutrition, environmental exposures, stress, exercise, and psychospiritual needs. So if you look at a person's whole domain of health, what they're eating, how they're moving, what their chemicals they're exposed to, optimizing each of these things can both prevent and in some cases treat and reverse disease states. So as long as that's your belief, you're practicing functional medicine no matter what the letters are behind your name. Functional medicine practitioners also believe that much of chronic disease is preceded by a period of declining function in one or more of the body's symptoms. So as a functional medicine practitioner who's working with thyroid patients, for example, and you have a woman sitting in front of you whose hair is falling out, she's cold all the time, she's starting to gain weight, she's feeling sluggish, but her TSH numbers look normal or almost normal in the range. And you're like, well, we're just going to wait until your thyroid gets worse, then we have some medical treatment for it. That's not how a functional medicine practitioner would approach that. A functional medicine practitioner is going to say, you know what, you're showing a lot of signs that maybe you have hypothyroidism. Let's improve the functioning of your endocrine system and see if we can stave off that condition, not wait until it's full blown. So the functional medicine practitioner of any kind is going to look at each patient across a broad spectrum of their life. We actually start looking at preconception. How was the mom? Was she stressed? Was she eating well? Was she addicted to heroin? That makes a big difference in a person's long-term health outcomes, right? So we look at a timeline and we document antecedents. Antecedents means basically what kinds of things might have contributed to the current issue that the client is sitting in front of you to look at. With anything that could be genetic, it could be something that happened in childhood. Maybe this client had had a sinus infection or an ear infection every year, and every year was on antibiotics, and now they're coming for me for digestive issues. Well, maybe the antibiotics in childhood had something to do with that. Maybe their mom smoked during their pregnancy. Maybe they had a really difficult delivery. Maybe they were never breastfed. All of these different things are antecedents, things that happened pre-delivery, during delivery, as a child, or even just 6 months or a year before the current issue. Then we look at triggers. So triggers are what triggered the current event. Okay, maybe you're seeing a mom who's struggling with postpartum depression or postpartum mood instability. Well, the trigger for that was the birth, was the mom being postpartum. It doesn't mean she didn't have any risk factors before or things she could have improved before, but she's in the office right now because that was the straw that broke the camel's back, was having that baby. And there's lots of different things that can trigger divorces. Having babies is certainly a common one. Getting in a car accident, having a viral infection, having some other kind of infection. Just, maybe 3 months of a lot of stress at work, can be anything that can be that straw that triggered the current health issue that the person's trying to address. And then mediators are things that continue to keep that situation going on. So maybe a woman who has postpartum depression, it was triggered by the birth, but now she's 8 months postpartum and it's still happening because she's eating really poorly. She has very little support. She has very little nourishment. Her baby has colic and food sensitivities and cries a lot, and she hasn't slept in 8 months. So all of those things are the mediators that keep that condition rolling along. So a functional medicine professional doesn't look just at the present issue. They take a very thorough history and note where along the timeline, maybe could have an intervention been done, or maybe an intervention was done, and what effect did that have? The functional medicine matrix is a tool that we use to really, again, take a wide range. It's kind of like the holistic health history, but this looks at lots of different domains. So how is your client's sleep and relaxation? Are they having any fun? Is your client exercising at all? Is she even moving, or is she sitting at a desk 10 hours a day? What's her nutrition? What's her stress level? What are her relationships like? Are they supportive? Are they energy draining? And then what is her physiology? And functional medicine practitioners look at this very micro. So like assimilation would mean everything from how well is a cellular receptor working to assimilate a nutrient, all the way up to, okay, maybe that client just moved to a new community, and is she assimilating there well, or does she feel like she doesn't fit in? The goal is to support the client's root cause healing, not just short-term symptom relief. So that's what it makes a functional nutritionist a functional nutritionist. You can practice nutrition and just hope to heal clients' symptoms. But if you're a functional nutritionist, you really want to support root cause healing, not just short-term symptom relief. Although certainly, your goal is relief of symptoms, but it's a little bit of a deeper process. Your goal is not to help your client lose 10 pounds so she can look great in that dress for the wedding, but then gain them all right back. You want to address the deeper issues. Using food and nutrient supplements as medicine, and the goal is for optimal functioning of all systems, cellular, organ, and community. So changing nutrition habits requires a combination of nutrition knowledge, understanding how to read the evolving medical literature, up-to-date continuing education in nutrition, and being sure that your clients are following good evidence-based nutrition recommendations. Maybe you have recommended them, maybe you haven't. You don't have to be a nutritionist to do that. You can be a health coach because you can get the recommendations from a trusted colleague. Maybe you work with a nutritionist as a health coach, or you work with a functional medicine physician or a functional medicine trained physical therapist, and you get the recommendations from someone who knows the clinical stuff. And then you as a health coach use your behavior change expertise to allow you to support your clients in the emotional and practical struggles that go along with habit change. Because we know that without coaches, clinicians have been giving good recommendations for decades. When I practiced purely physical therapy and knew nothing about health coaching, I would give my clients recommendations week after week. And a lot of times they didn't do any of them, right? Oh, I didn't do my home exercises. Yeah, I'm not really sure why. And so certainly clinicians can also gain health coaching skills and highly benefit from them because it helps you to make sure your recommendations are gelling with your client's goals. And so thus they're more likely to actually do them, and you have skills to help them actually follow your recommendations. I think it's only about, so even if I'm a physician and I'm just recommending a certain medication to a patient who agrees that she should take it, which isn't always the case, there's only a 20%, maybe it's between 20 and 30%, but I think it's closer to 20% compliance rate with even just taking a pill. So if a physician says to a patient, okay, I want you to walk every day and change your diet and sleep differently, when they give them even pages and pages of specific recommendations, the likelihood that that client is going to do it without coaching is extremely, extremely low. So your title as a nutritionist, as a health coach, other than the legal aspect, which is very important, and you need to make sure that you understand that, matters less than your knowledge. And this depends on, in many cases, so depending on the Nutrition Practice Act in your state, health coaches can offer skilled nutrition recommendations. If you specialize, that makes that easier because you only have to know a lot about one area. I think in any area of clinical practice, specialization is a good idea. But as I said, we'll get to that next week. And nutrition professionals, all healthcare professionals actually, really need to have health coaching skills for the reasons I just stated. We can give recommendations till we're blue in the face, but if they're not gelling with our clients' understanding, their needs, their motivation level, their stage of behavior change, readiness, they're simply not going to execute those recommendations because they're busy. Their lives are full. They have emotional needs that they sometimes are, self-medicating for. They have particular beliefs. They might be low in change readiness. So all nutrition professionals and all health coaches have a lot of overlap in their skills. In an ideal world, both health coaches and nutritionists would develop skills in both disciplines. And then you can call yourself whatever you want or whatever makes sense to your state practice act. It's important that every clinician continue her education in both disciplines throughout her career. Licensed healthcare professionals are generally required to do this. To maintain my physical therapy license, I have to take 30 hours of continuing education. I believe it's every 2 years. And each state has different requirements, but that's about average. All health professionals benefit from education in health coaching and nutrition because no matter what your clinical discipline is, if your client's not eating well, the medication that you give them is not going to work as well. The exercise program that you give them is not going to work as well. All of the recommendations that we give work better in an environment where the client's body is full of nutrients and not full of inflammatory things like sugar, for example. So all health professionals benefit from education in health coaching and nutrition because at the end of the day, with the chronic illness that we're dealing with in all Western countries, each individual patient or client day-to-day choosing healthier behaviors is what's going to unwind that. It's not going to be some magic pill or surgery. It's going to be lifestyle shifts, and that takes a lot of support. So I did receive some questions, and it looks like we've got some comments going on here in the chat box. So let me read those for a minute, and then we'll go over the questions that I received by email, and then you guys jump right in and start asking your questions. So good. We've got Moni. She's saying that she's feeling much clearer. I'm so glad. Renee. She's saying, thanks for saying she can help change habits as a health coach. That's 100% true. That's essentially your clear expertise. And if you feel like your skills are wobbly, that's where we work on that. Or you just need more experience because the expertise of a health coach is habit change. And it's essential to our healthcare conundrum right now in the Western world. All right, great. So no matter what your discipline is, where you're coming to us from this call, what location you're coming from, Go ahead and type in the chat box if you have any questions on this. And in the meantime, I'm going to dive into some of the questions that were emailed to me. So the first question is, I'm currently studying health coaching and wondering how I should present my service to physicians in order to partner with them in providing care for patients. So now that you're clear regarding your role as what a health coach is, consider all of the ways that you can support that physician's patients to be more successful. You're going to help take that physician's recommendations that she and her patient have agreed on. Let's say your patient and her doctor have agreed that she is going to do a daily walking program. Now, your job as the health coach is to bridge: what time is she going to walk? Where is she going to walk? What shoes will she need? Is she going to have anyone coming with her? Does she need to bring any medication on the walk or a phone? Does she have any, risks that she needs to buffer? So the physician and the patient can say, okay, going on a walking program. The health coach helps the client figure out and execute all of the details. And the other thing is, I would recommend, if you're a health coach, that choose the physicians that you work with carefully. Do they align with your vision, or are you going to be just helping clients, consistently take their medication? Now, that can be highly valuable, but if it doesn't align with your values, then it's going to be a frustrating job for you. Would you feel comfortable referring your patients or clients to this physician? In some cases, in all cases. So critically evaluate the physicians that you work with. Another question I got was, what do you suggest for someone considering going back to school to study nutrition and holistic living? Number one, determine what your vision is. Do you want to specialize in a specific population? Do you want to work in a state with a rigid nutrition practice act? Then maybe you really want to go ahead and get certain letters behind your name. Do you want to focus on behavior change with a collaborative team of colleagues? What does the job look like that you want? That's going to really help to clearly define the education that you need. Why do you want to study holistic living and nutrition? Another question, what's your advice for someone wondering if nutrition or health coaching is his or her right career path for the moment? How can you know this is something to pursue that won't be just a misallocation of money? And again, this comes back to your goals. What population do you want to work with? What kind of clinician do you want to be? Are you ready to commit to a career that requires lifelong learning? What does the career involve? So, and let me answer a few of your questions. And I also got many people asking, is the Women's Health Coach certification right for me? Because our institute teaches a health coach certification program. And I would say yes, sometimes. But again, it goes back to your goals. Do you desire to practice health coaching with nutrition and possibly other skills to help women lead healthier lives? If you enjoy working with specific populations, pregnant and postpartum women, female athletes, women recovering from cancer, women struggling with fertility challenges, other populations specific to women or adolescent girls, then this is, yes, the right certification for you. If you want to work with little kids or babies or men, this is not the right certification for you. If you want personalized attention, we only accept 30 students in our program per year. We're not looking to certify thousands of clinicians just broadly. I want someone who wants to really deeply develop her skills, who wants my personal attention and that of our faculty in our program. We do use an integrative, evidence-based functional nutrition approach. We are not attached to a single food theory. Like, not everything we teach is about raw food, veganism, paleo, or the government food pyramid, which is some of the programs require that is your perspective. I look at the research. I don't have a horse in the race regarding what's best for any given client. If a paleo diet is ideal for my specific perimenopausal woman looking for lose 10 pounds, and that gels with her, that's what we're going to work with. But if it's vegan, I've had clients of all persuasions, vegan, paleo, ketogenic, whole foods diets, and it all can be appropriate, but you have to know how to apply it based on the client and the research. And that's what we teach. We teach really critical assessment of that. Also, this program is right for you if you want that perspective of learning both health coaching and functional nutrition skills, because I actually believe that all clinicians, but certainly nutritionists and health coach, should have skills in both of these areas that they continue to develop through their whole career. And if you want the opportunity to practice, so again, we only take 30 students in each of our programs each year because you're going to have, a lot of attention in our private Facebook group. You'll have, if you're in the NCCHWC accredited version of the program, you will be practicing your health coaching skills with a mentor coach who has a lot of experience. Most of the time, that's me at this point. All right, let's see what other questions you have. Okay, so if you have another license, if you are an RN or a social worker, and you're functioning in the role of a health coach, should you drop the other letters? And again, this is a legal question that I would clarify, but it's my understanding that no, once you've earned those letters, you can use them. My signature has all my letters, but I've practiced as a health coach. So you want to be sure your practice is clearly defined as just health coaching, that you're not also doing social work, or you're not also doing RN tasks, but that your practice definition, so the practice agreement, will have something stating when you work with each client, I am a licensed registered nurse, but right now I'm practicing health coaching. But anytime you have a signature, you kind of put your name on an article or a book or something, it can have all of your letters. Once you've earned them, you get to keep them. All right, Julie, lots of great questions. Yep, lots of research to check on the state's laws. Yep, make sure you do that. So is the women's health coach certification close to being a naturopathic doctor or registered nurse? No, it's a distinct thing. So our program is a health coaching certification. You will learn a lot of skills that naturopathic physicians use because you'll be learning a lot of functional medicine, functional nutrition. But it's a different training. We are certified and accredited by the NCCHWC, and I think that's important. You can learn more at this link about our program, really specifically what's included, what the certification involves. And if you do register for our program, by the end of this month, you'll be invited to a complimentary live webinar group coaching session where we can actually chit-chat together to really focus on your women's holistic health career vision. So if you believe you want to practice in women's health, you want health coaching skills and you want functional nutrition skills, and you want to drill down on exactly which population you want to work with, where to set up your practice, all of that kind of thing, we'll discuss it in that live webinar if you join our program prior to the end of this month. And a question about insurance reimbursement. Generally speaking, health coaching is not covered under insurance reimbursement. That is something you will, again, follow up with the attorney that you use for your business or the insurance companies that you're contracted with. You can ask them because some do, or you can use things like health plans that are part of health savings accounts that are part of your client's work-related incentives, benefits. And there are some newer kinds of health insurance that do cover things like supplements and healthy living. So that really depends entirely on the client's insurance company. The question is, who are your other core teachers for this training? So I've written most of this training, but we do have lots of guest lecturers. Laura Ritchie, Julie Granger, and Michelle Lyons collaborated with me on some stuff for our female athlete module, which is outside of this particular certification, but we do have some guest lectures from them on those topics. Guest lectures from Emily from Institute for Psychology of Eating, Emily Rosen, she spoke on our program. Hyla Cass, who's an integrative, she does mental health. She's a physician, integrative psychiatrist. And so there are, I've called in a lot of my friends. Isabella Wentz gives us some training on Hashimoto's. So we've got a number of guest speakers, but the core training is delivered by me. Marianne Ryan teaches, did an interview with us regarding postpartum recovery from a physical medicine standpoint. So we do have quite a number of guest teachers throughout the program to add some perspective. Nalini Chilkov talks a bit about cancer, her integrative approach to addressing clients with cancer. So many of my friends have offered us, little bits of their wisdom. And I think it's very useful to gain some, other perspectives. Andrea Nakayama talks about the immune system and how that's important in cancer. So there's a lot of small snippets, but the core program is taught by me at this point. And we're looking for probably next year, we will bring on a second mentor coach. But this year we're limiting the group to 30. We've had 2 previous years where we've had some other faculty as well in guest lecture capacity, but I've always primarily taught this program. Does the program focus on motivational interviewing? Yes, we do teach motivational interviewing as a skill set, as a strategy. But again, it's not the only tool that coaches use. It's one useful tool, but it's not the only tool. And yes, we do look at motivational interviewing. Do we go into chronic disease states? So let me show you a bit about the program. So if you look at the data, you can see why I choose to work with women. Truly, the number one reason is my passion. But the number 2 is women are seekers of health and wellness and information and support and treatment. And so it's a great population to work with. We'll get more into that in our specialization webinar. There are 2 paths to certification. One, our larger program is NCCHWC accredited, and that's important. Then the second is all of the same content, but you don't have the practice sessions with me, where you don't have a practical exam. There's less kind of one-on-one group, both private and group coaching around your professional goals, your own personal vision. We really believe in supporting each of our clients. And I do a lot of that one-on-one and in small group sessions with this larger program, less so in here. This is more a lot of content, just like all the content you can need. If you've already got just a great successful practice and you just want more knowledge, you're in that continuing education part of your journey, you want to learn more about women's health, then this is the program for you. And then what exactly do we teach? There are 19 modules on health coach skills education. This will include things like motivational interviewing, visioning, values conflicts, what are the scope of practice, legal issues, health coaching models, like that model of wellness, the health assessment, and getting progress out of your clients, authenticity, boundaries. Creating professional boundaries is a hugely popular module. Behavior tracking strategies. And again, this is very women focused. We look at menstrual cycles, fertility cycles, the realities of modern work-life balance for men versus women. It's very women focused. And then in terms of the healthy lifestyle education piece is all grounded in functional nutrition. So we apply this to digestive function, to stress, the mind-body medicine, including the stress response, cardiovascular disease. So yes, we do talk about diabetes, but we talk about how functional nutrition applies to cardiovascular disease states just in women, because it's very different. The literature is very different between men and women, and that's very rarely talked about. Women have PCOS. They may be female athletes with something like female athlete triad that could later impact their cardiovascular health. We talk about autoimmunity because women have high rates of autoimmunity compared to men when we go into our immune system module. Hormone health from puberty and beyond. Obviously, this module is extremely different between men and women. Women and mood disorder, psychoneuroimmunology from a women's health perspective, creating a health coaching practice. This is one of my, I think this module 27 is so important. You gain all this wisdom in the 26 modules before that. Then you build your practice, and we want to do it in such a way that you are protecting your own health. So I feel really strongly about not having our students burning out and being focused on their needs as they build their practice. All right, any other questions? And you can read more about this at this link here. Integrative Women's Health Institute. It's under our professional resources, Women's Health Coach certification. All right, great, Moni. I'm glad you liked that. Excellent, Sarah. I'm glad you enjoyed it. All right, anyone else before we wrap up today? I'm sure everyone has to get back to work. All right, well, I'll send you the recording as soon as it's available. And if you have any last questions, feel free to email them to us. And I hope you guys have a wonderful day. Thanks so much for being here. It was great to be with you too. Thank you. All right, thanks so much, Julie. Thanks, Kristen. Bye-bye.